Respected chairpersons, seniors, ladies and gentlemen, the topic of my video presentation is initial experience with indigenous suction sheath Superperc during percutaneous nephrolithotomy. I am Dr. Rahul Janaksena. Greetings from Patna. Percutaneous nephrolithotomy is the standard of care for large kidney stones. Complications like fever and bleeding can represent major concern. To reduce the morbidity associated with this procedure, miniaturized PCNL systems have been developed. These systems have some limitations, such as difficulty in stone fragment retrieval, smaller visual field, longer operative time, higher intrarenal pressure. Intrarenal pressure higher than 30 millimeters of mercury or 40 centimeters of water may cause pilovenous backflow, leading to infectious complications. To overcome these drawbacks, many PCNL systems with suction aspiration sheath have been introduced. The real-time suction of irrigation fluid, stone fragment, and blood throughout the procedure may lower intrarenal pressure, improve visibility, shorten the operative time. Choice of suction sheath available in the market is limited. Ultra mini percutaneous nephrolithotomy, developed by Dr. Janak Desai sir, is one of the latest mini PCNL innovations from India. Super mini percutaneous nephrolithotomy, developed by Guo Zheng, is another such innovation. In the field of modified suction sheath, clear Petra sheath is popular abroad. Superperc is an indigenous suction sheath developed by Dr. Kaushik Shah sir. In these photographs, we can see the different parts of Superperc sheath. In these photographs, we can see the entire assembly of Superperc sheath within the pelvic calycial system. On the right-hand side, we can see the photograph of stone catcher bottle and the vacuum device. Aim of this study is to assess the utility of Superperc sheath in our setting. This was a retrospective single-arm study conducted between October 2021 to October 2022. 36 patients with unilateral renal calculi underwent PCNL. The patients were treated with PCNL using patented suctioning Superperc sheath. Data included patient and renal stone characteristics, intra and perioperative parameters, post-operative complications, stone clearance, need for retreatment. Comorbidity was graded according to Charlson Comorbidity Index. All patients underwent preoperative CECT KUB, urine routine and culture, along with other routine investigations. In case of positive urine culture, antibiotic targeted therapy was started 3 to 5 days prior to surgery. Intraoperative parameters included number and location of the percutaneous tract, fragment retrieval modality, exit strategy, operative time, intraoperative complications. Post-operative parameters included hemoglobin drop, need for blood transfusion, nephrostomy indwelling time, length of hospital stay. Post-operative complications were graded according to the PCNL adjusted Kevyan score. Sepsis was defined according to the SOFA score. Stone clearance was defined as the absence of residual fragments larger than 4 mm on X-ray KUB. PCNL was performed using 12 French and or 20.8 French nephroscope by Richard Wolf. 15 French, 18 French, 21 French, or 24 French Superperc nephrostomy sheath were used. Superperc sheath has two outlets, one for controlling suction pressure and another outlet connected to the vacuum system. Larger fragments are retrieved by drawing back the nephroscope inside the sheath as far as the internal opening of the lateral aspiration arm. Aspiration pressure can be regulated throughout the procedure according to the surgical needs. In this video, we can see the endo view on the left side and the open view, outside view on the right side. In the endo view, we can appreciate the smaller fragments being sucked by the side of the nephroscope into the suction sheath. On the right side, we can see the larger fragments being pulled into the suction sheath when the nephroscope is pulled back during the surgery. Standard prone PCNL was performed. Renal puncture was done under fluoroscopic control. Tract dilatation was performed using Alkin technique. 12 French, 15 French, and 18 French Superperc sheath slid over the Alkin dilator of similar size. For 21 French and 24 French Superperc sheath, Alkin dilators were removed. Superperc sheath slid over the guide rod with its accompanying one-step dilator. After introducing the nephroscope in the pelvic ileal system, the suction was switched on. Lithotripsy was performed with 550 micron holmium YAG laser fiber or pneumatic lithoclast. A nephrostomy tube or ureteric catheter or DJ stent was placed as exit strategy. The complication rate was 16.6%. Slight drop in hemoglobin in the immediate post-operative period was observed. Urine leak from nephrostomy site was observed in some cases, which stopped spontaneously within 48 hours. Average hospital stay was 2 days. 3 patients experienced fever, which was managed by antibiotics. Complete stone clearance was observed in 32 patients. Of the 4 patients who did not have complete clearance, 2 underwent repeat PCNL, 1 patient underwent RIRS. All 3 had complete stone clearance after the second procedure. The 4th patient had non-obstructive residual fragments smaller than 10 mm, which was managed conservatively with periodic ultrasound imaging. One of the main advantages of Superperc sheath is working with the suction aspiration sheath in close contact with the stone. The vacuum keeps the calculus in position during lithotripsy. Suction directly attracts fragments, thereby preventing their scattering. As in the SMP series in literature, we observed lower postoperative fever than reported for PCNL. Zong and colleagues observed that mean intrarenal pressure more than 20 millimeters of mercury and cumulative time longer than 50 seconds, along with intrarenal pressure more than 30 millimeters of mercury, correlated with postoperative fever. The main limitation of this study is the lack of control group of PCNL procedures performed without suction aspiration system. To conclude, PCNL via Superperc sheath is characterized by good safety profile and satisfactory stone clearance rate. The interesting feature of this innovation is easy suction-mediated stone fragment removal, reduced operative time, low intrarenal pressure, and low complication rate. Percutaneous nephrolithotomy with the aid of indigenous suction aspiration, Superperc sheath is economical, practical, and warrants clinical promotion. I thank you all for patiently watching this video. Thank you.